All across the country, unemployment numbers are skyrocketing. San Diego is no exception. Today, the head of the San Diego Workforce Partnership announced the nonprofit has moved all their services online, and he urged out-of-work San Diegans to check out their website, workforce.org. And a major bit of philanthropy from San Diego's Lucky Duck Foundation.
And in partnership with Family Health Centers, they will begin COVID-19 testing for all unsheltered individuals who are currently in the convention center. The testing will start on Thursday with 150 tests a day. They will ramp up to 250 tests a day until they have tested everyone.
So we've gone through a series of what I would refer to as pandemic response shifts.
Governor Newsom started Tuesday's briefing recounting how we got to where we are, the various steps Californians have taken to flatten the curve, the effort to prepare the state's healthcare system. Then a pivot to the question just about everyone wants an answer to: when will the stay-at-home order be lifted? When will things get back to whatever the new normal will be?
But this phase is one where science, where public health, not politics, must be the guide.
The governor laid out 6 steps he says must be taken to slowly begin emerging from this crisis. First, the ability to greatly expand testing to be able to trace and track people who've been exposed. Maintaining vigilance and protecting the most vulnerable among us, seniors, people with suppressed immune systems, the homeless. Addressing the continuing needs of hospitals and clinics throughout the state, making sure they're ready for possible future surges and infections with equipment and protective gear. Continuing to engage universities, biotech companies, and national labs to coordinate efforts to develop therapeutics and a vaccine. Redrawing floor plans. Governor Newsom says that means rethinking how people move about in businesses and schools to work in as much physical distancing as possible. And the last one, the governor says, is probably the most difficult: the ability to reinstate restrictions if the need arises.
If indeed we lean in, but we have to then lean back out as we toggle from stricter to looser interventions, back and forth.
But back to the big question: when? The governor had an answer, sort of.
In 2 weeks, if we see a continued decline, not just flattening, but a decline in hospitalizations and ICUs, and we see this workforce and the infrastructure and PPE needs met, as we anticipate around May, first week in May, to start seeing the benefits and fruits of that, ask me the question then.
John Carroll, KPBS News.